Dr. Alina Alonso has served as the Florida Department of Health Palm Beach County Director since 1989. As director, Dr. Alonso oversees the operations of one of the largest county health departments in the state. She is the medical voice of the County of Palm Beach, where matters of public health are concerned. Dr. Alonso has provided ongoing guidance to the citizens and decision makers of Palm Beach County on the COVID-19 public health crisis. Maggie Zeidman brings us an insightful interview with this public health leader.
Thank you for being with us because I know how busy you are, and we really appreciate it. Our town has looked to you all along for the last 9 months, and here we are today sitting here with you, having you help us with this next phase that we're going into. So I just want to thank you for that. Your job is huge. You serve the healthcare needs of a widely divergent population, from maternal child health, the homeless, schools, prisons, the elderly, and the town of Palm Beach. The public relies on the department, the director of the Department of Health, the doctor, to tell us what to do. And doctors are doctors always the head of the departments of health?
No, they're not. The larger counties definitely have physicians, but some of the smaller counties have administrators, and then they use just a medical director to do their clinical work. But we've been very fortunate. We've always had a doctor. We've had only 4 directors, actually. I'm the 4th director. So in all these years, since the 1950s.
You tell us what to do. Dr. Fauci tells us what to do. Dr. Redfield tells us what to do. Dr. Birx tells us what to do, but we don't do it. And therein lies the problem, So tell us where we are today, here in the county, here in the state. We'll start with the state, macro, the state, the county, and then our little town.
Well, it's very important that we even look at it globally, right? Because this is a global problem. Every single country is involved in this, not just us. And so the United States right now is in a 3rd peak, in addition to being the 2nd wave. Early on in the pandemic, we talked about that there would be a 2nd wave in the winter. We were hoping that it'd be all over in a few months. Well, obviously it's not, because viruses don't work the way we want them to work. They work the way they want to work. And this virus is following that same pattern. So we're in the 2nd wave on top of a 3rd peak, which right now there's over 100,000 cases per day coming into the United States. And so Florida is doing better than some of the other states, and Palm Beach County is doing much better than Miami. We have a very large population of the whole state, and so we're large counties with metropolitan areas over 100 million people, and so we have more of a burden than the rest of the state, right? It's natural because we have large concentrated communities with transportation and people moving. And also we receive a lot of that population coming from the north, especially now in our winter. We know we have a lot of tourists that will be coming, and lots of people that come here regularly this season. So because of that, we are expecting that this 2nd wave is definitely going to be very, very serious now in December and January. We had a little reprieve with our numbers going down, our positivity going down. And that, I think, had a lot to do with all the people that traveled. Over 1 million people traveled over this holiday, even though the CDC was asking people not to travel. And so we had a little bit of a reprieve because a lot of people got tested and they were negative. So that large number of activity into testing reduced that positivity. But now, as we see, our numbers are going back up. Yesterday, we had 9.87. And so we're going to see this number fluctuating with more people getting tested. The CDC also asked anybody who had traveled, that 1 million people that traveled, to get tested, because the fact that they've traveled, they've come in contact with the virus. So we definitely encourage people to get tested now that they've come back, to make sure, because there's so many people that are asymptomatic with this virus. That's another very important thing. So for that reason, our expectation going into this is that we're going to see a lot more positivity and a lot more of the virus.
So you get a dinner party together and everybody looks okay. You look okay. You feel okay. They look and feel okay. But you're sitting next to each other and you have masks off because you're having dinner with one another. And the next thing you know, about 5 days later, someone has symptoms. And then somebody else has symptoms. And so we've had a few occurrences of this happen here in the town.
You have to assume that every single person that's next to you is positive. If you keep that notion in your head, you can protect yourself better. You cannot assume that you're close. We call it our close bubble, right? We have a certain group of people that we know, perhaps our family members, and we feel safe with them because we know them. But the moment they go out to the street, or they go to work, or they go to play, or they go to the office, they're coming in contact with other people. So when they come home, they're no longer that safe bubble anymore. So you have to keep in mind that everybody that you get next to, you have to assume that they have the virus. Then you can protect yourself, because then you're going to keep your mask on, and you're going to stay. If you don't have your mask on, then you need to stay away from them. So how do you do that when you go to a dinner party? And I've done it, right? So I've gone to my friend's house, my little bubble. I have two bubbles that I circulate in. And I go to the first bubble and everybody's doing fine. So we sit down for dinner. If we sit down to dinner next to each other, the way we normally sit in a table, we're taking a big chance. Now, everything with the virus is a matter of mitigating, right? We can't eliminate the virus, and we all take chances that we're willing to take. So when my son came home from Tallahassee, I hugged him, and he got very upset with me because I hugged him. He says, "You can't hug me." I said, "But I have to hug you."
Mhm.
So there are some things that we're willing to take a chance on, just like we drive on 95, and I needed to hug him, but he was correct. I should not have hugged him. I should have waited until he was here for a few days so that I knew he was safe. The other situation that occurs is that we feel, well, it's no big deal, right? You're just going to be sick for a few days. So if I hug him, the worst that can happen is I'm sick for a few days. Well, it's a little more complicated than that, because the fact that I'm going to work means I'm going to then expose other people to my illness, because I'm not going to know that I have it, because chances are I'm not going to have any symptoms. So it's not just the chance that I'm taking, it's the chance that we're exposing everybody else to. So at work, you can wipe out a whole department. If you only have 4 or 5 people at work, that whole department may be out because one person, I call it messing up, wasn't cautious enough to take that precaution. And then you have 4 or 5 people out at work. The other problem then is consequences to this virus. We cannot take this seriously enough. We are finding more and more complications. It's not just getting the flu. You may recover and just get the flu, but there may be long-term consequences. People have been hospitalized, and healthy adults that run, that do exercises, that are perfectly fit, have had a very hard time coming off of this thing. So you're taking a much greater chance than you think.
So Christmas is going to be difficult for us.
We are actually making civil sacrifices, each one of us, when we decide not to take that trip or not do that for this year. And somebody said it, I think, very well. They said, we're doing this year. We're not seeing you this year so that we can keep seeing you for the years to come. I think that anybody who has to live with that, maybe they caused somebody's death, is very, very hard to do. We do want to keep the schools open. The problems where I'm seeing are the clubhouses, the private clubs, the nightclubs, the bars, all you have to do is drive down Clematis or drive down Atlantic Avenue, and you see where the problem is. It is not, in the classroom. It's at these places where you're gathering without the masks, large crowds.
Let's talk a little bit about, you brought up the positivity rate. Tell us about that. Sometimes I'm asked, what's the equation?
We were talking about the total positivity and then the daily positivity. The important one is the daily positivity. That is the number of tests that we do today, and the number of positive tests that we have on that day. So that's the daily positivity. So the number of positive tests for today divided by the total number of tests that we do. And there's two ways to calculate that. They're both correct. The CDC came out with a statement in terms of a little differences. The different counties, different states are doing it a little bit different. They're both correct. The important thing is to keep the same equation the same throughout the event. And that's what we've done. So here in Palm Beach County, we take total number of positive people that we have today divided by the total people that were tested. That tells us how much viral load is in the community on that particular day. That's the daily positivity, and that's the one that we saw all the way down to 2 back in October, I believe you mentioned. Yeah. And now it's up to, yesterday was 9.87. We want to keep that number below 5. Why is it 5? It wasn't something Dr. Alonso invented. It's the reason that that's the number that you can do accurate, not only accurate, but have an effect on terms of contact tracing. That's done specifically by the health department. All those questions are confidential. We do not ask you anything about we don't ask you for your social security number or your Medicare number. Those are scams. Please be aware of those. People are offering you free devices and things if you give them your Medicare card. Do not do that. That's a scam. That is why that 5% is so important. If you get down below 2%, down to 1%, then you've controlled, you have the virus in check in that community. And there are, those are called green spots across the nation. And there are some communities that are down to that 1%. That's where we want to get to. That brings up a second problem. Every time I make a statement, I bring you another problem. That we've had some people that have been infected more than once. So now that puts another wrinkle into the equation, and why I say this virus is not normal. It's acting different than other viruses. So we have had actual documentation of people that were tested by PCR positive. They later had a negative test, so they recuperated. They went back to work, and several months later, now they got symptomatic again, got tested, and Lord behold, they're positive again.
What is the accepted general thinking about immunity for SARS-CoV-2?
Well, the reason we do the flu vaccine every year is because the immunity lasts between maybe 2 years. And so therefore you do the vaccine every year. So you always do a vaccine shorter period than what you expect to have immunity. But there's a wrinkle in this, right? Because if you can get infected twice, so if the actual disease doesn't give you immunity, how are we going to get immunity? Do we have to get it 2 times, 3 times? What about the vaccine? So the vaccines that have come out now, Pfizer and Moderna, they both have to have 2 shots. You have to get 2 shots. So, and you have to get the shot from the same manufacturer that you got it the first time. So I can't get Pfizer the first time and Moderna the second time. You have to get, if you start with Pfizer, you got to get your second shot with Pfizer. So we're going to give you an appointment for the vaccine, and we're going to give you at the same time your appointment for your next vaccine. They have claims that their vaccine is very, very effective, 95, 94%. That's unheard of. The regular flu vaccine is about 40% effective. Okay, so and yet we take it. I take my flu vaccine every single year. I'd rather have 40% than nothing. We are now going to look to see how long the immunity lasts. We don't know that yet. With the second vaccine, when you get the second one, you might run up a little fever and have a little cold. So we also want people to space out their employees so that we don't all end up with the cold on the same day and everybody has to close down the for that day. So there's a lot of planning involved in what's coming up. They're also going to be giving out the vaccine in phases, with the first groups being long-term care facilities, hospitals for the hospital personnel that's taking care of patients, and then first responders, which include fire rescue and law enforcement. So those are the first ones that are going to actually have their hands and get the vaccine. The vaccine for the general population probably will not happen until after April, May, maybe even into the summer.
When you get the vaccine, are you immune immediately?
It definitely takes time for the immune system, approximately 6 weeks. And that's something everybody needs to be very aware of, especially if you're traveling. Hopefully too many people aren't traveling right now. They're not thinking about that. But anytime that you make plans, you need to get vaccinated. You need to have time for that vaccine to actually work.
The question that I get, and I'm sure my colleagues get, and certainly the mayor gets, is this: who is positive? Why won't they tell us who is positive? Where do they live? And, I say to them that that's not going to happen because of people's privacy. We cannot, in fact, I don't even know. Sometimes I may know, but I'm certainly not going to share the information. Can you address that once and for all for everybody? We don't have that information, nor should we.
Absolutely. And we keep epidemiology. The reason we have the huge responsibility of doing contact tracing is because we have special permission based on our statute of being able to obtain this information from people to prevent the spread of the disease. It's a very powerful privilege that we have, and we have to guard it and keep it very secure. So we would never talk about a specific patient. We would never say that John or Joe have COVID and they live at such and such address.
Another question that we get is is this: if I'm sick, if I have symptoms, how do I notify the Department of Health? Does my doctor notify the Department of Health, or am I responsible personally to notify?
You can ask us for any assistance you need, but the first thing we're going to ask you is, have you talked to your doctor? Because your doctor knows your medical history. We can tell you exactly what you have to do in terms of the virus, where to get tested, what you should do, how many days you should stay home, and so forth. But your doctor has your own personal information that will give you additional knowledge and things to do and not do. Okay, so the responsibility to report the test belongs on the physician that orders the test, but the labs also electronically report the lab results to us, specifically for this COVID pandemic.
What would you say to us, to our town, about surveillance testing using the rapid antigen test, or surveillance testing even using PCR, though it does take time to get a PCR back?
If the test is only as good as how much virus you have, so it may be that it's too soon and you don't have enough virus for the test to detect that you're positive, okay? So the test is only good for screening. It's not going to help you stop the spread of the virus, okay? The stopping the spread is only going to be doing by the mask, the distancing, the washing your hands, and staying away from those crowds. So if your community starts having higher numbers, yes, you might want to test so you know who is sick, but we're going to have to stop how the virus is being spread. How is it being spread? The testing, yes, it will help us know who's sick and how to treat them. That's very important. But stopping the virus, stopping the spread of the virus, has to be a community effort where we all willingly and knowingly take these steps in order to stop the spread.
One thing I forgot to ask you, Dr. Alonso, is about the hospitals, how they're doing locally. What's the availability in terms of the beds in the general area, and also in the ICUs? Have we seen an increase?
We definitely have been, seen an increase in the number of COVID coming into the general beds as well as to the ICU beds. Those numbers are going up, but we have a very good control. The hospitals in Palm Beach County are, for the moment, handling this quite well. We know how to treat the patients better now. We have more available tools and drugs to help do this. And so I'm very, very proud of our whole medical system here in Palm Beach County. The other states where you're hearing of the drastic measures that are occurring is very real, because everything is happening throughout the country at the same time. We don't have the resources that New York had to be able to I mean, lots of people from Florida went to work to New York to help them out. Now nobody can go anywhere because everybody's needed where they are. So it's a very, very strenuous situation for the whole country right now. And this is going to be the worst part of the pandemic, December through January.
So we're coming into a very dark period.
Yes.
And you would like to tell us, I'm sure, how we can, do we have an opportunity to turn that back, the dark period? Do we have an opportunity, or are we just going to have to accept it?
I'm going to put it this way. We always have an opportunity to mitigate the virus, make it less than what it was going to be. And Palm Beach County has been doing that. We've been ahead of our southern counties. We've been ahead of the game in the hospitals. The public in this county has done a great job wearing their mask, maintaining the distancing, staying home. We need to knock that up a notch and take this very cautiously so that we can help to stop the spread now that is spreading so widely. We're going to have a lot of people coming into the county, very, very heavily infected with the virus, and it's going to come down here. So we have an opportunity to heed the warning and wear our mask, stay the distance, avoid the crowded spaces, and keep the virus as low as possible in Palm Beach County. We can do that together.